So part of the wood therapy is to do some nice skin brushing. You can use either a brush or you can use, you know, like a sisal mitt or those gloves, those exfoliating gloves. You could use that or a brush. And what we do is when we do that, even if you've got one of the gloves on, we're going to do a hand over hand vibe. And you would do this up the legs as well. So you brush and brush. Just you, I'm sure you've seen this or done this for yourself, but it's not like full on hard. It's just a nice, good pressure. And I'm just going to lift up and over and just do it on the inside as well. Let's have that. And then up towards the lymphatic nodes, and then up towards the thoracic ducts at the top of the root of the neck, the top of the body. So yeah, I like the hand over hand. It just smooths it out. So you can use that with a brush or with your mitts. And you can do that each limb. Or you can do the whole of the body to begin with. You can just start off with doing the whole body. So you could uncover, like you would start by just uncovering one whole side of the body, so that you would do all the leg, bit of abdomen underneath the side, and then coming up towards the arm. The body will respond beautifully to having just one side at a time. You don't need to do the back. It's just like, you know, if you do your own skin brushing, you can do, you know, you can do your leg, come up to the side of your body, and then you can do your arms. So, you know, the skin and the body knows how to process that information, if you like. So it doesn't have to be like intricate, like this. The body, if you're doing a general skin brush, it will benefit. But yeah, we try and be as thorough and as complete as we can. So that's something that's available for the whole body. Let me carry on with the wood therapy now. So I'm just going to apply some, we've got lovely balm here, like a liquid wax with a balm with some apricot kernel oil mixed in with it to make a liquid wax. So lots of effleurage, lots and lots of effleurage. And that's what's so lovely about this, is that you're not having to do deep tissue massage. We're just doing lots of lovely effleurage. And you could certainly stand here. And what we've got here is the axillary node. If you remember from your anatomy, is you've got the axillary node underneath the armpit. So we're heading towards that axillary node, and then that in turn is going to head up towards the thoracic ducts. And at the thoracic duct, the lymph tips into the subclavian vein and then would enter back into the superior vena cava and back to the heart. So up here, we're up close. Good. And then, so once we've done lots and lots of lovely effleurage, for this, I'm going to use the nodular tool again. Here, we've got a nice nodular tool. So I'm supporting really well here. I've got my thumb supporting at the crook of the elbow, at the elbow crease. And hear my cheeky Sharpay out there. She'll kick the door at some point. Okay, so I'm working all around underneath by the tricep, supporting well. Sure we've got enough of that on. Really nice and stimulating. And then actually, because I'm supporting, I'm going to select this tool here, because then I can really support well. You can also have the position where you can invite your guest just to hold on to the top of the bed here, so that you're supporting here or whatever. I'm left-handed, but I can work with both. So I'm supporting. You can see how effective this is. can see how effective this is with the erythema. I'm going to switch out. I'm going to use, so depending, like this is good. This is what I was saying in an earlier video, is the sides of this board are so good because you can work exactly how we wish. Let's just get a little bit more here. I'm just going to release your hand a little. Just for the sake of the video, we'll go a little bit shorter, but you can see beautiful erythema. If you can't see, there's great erythema here. And I'm coming into. What's also really good to do is at the beginning of the treatment is you can just work to gently pump the thoracic ducts. So just super gentle. So just super gentle pumping just above the clavicle. You can do above and below, all around here, above and below is nice. And this just enables the clavicle, sorry, the thoracic duct, excuse me, to open. Amazing. And then we're going to just conclude here with a little bit of, I'm just going to actually get a little bit of oil just to conclude this part. And I might just return, let me just step back, return here. Some nice effleurage. Okay. Now, depending, you know, if someone's got, there's different techniques. You know, this is if somebody's got puffy wrists, I would do a manual lymphatic drainage technique. That would be a different technique entirely. This is a different course. It's a different training course because today we're doing wood therapy and addressing where there is fatty deposits and excess tissue fluid that's causing bloating or puffiness. But here, if I wanted to work towards the supratrochlear nodes because of puffiness here, it would be a different and very light manual lymphatic drainage technique. Just so you know, you can work differently with MLD massage around the body. Okay, thank you so much for that.